And good morning. This morning we are talking with Charles Fuschillo. He is the President CEO of the Alzheimer's Foundation of America. Good morning, sir.
Hi, good morning. Thanks for having me on.
I always hear about the other organization, but this foundation seems to be a little bit more need-based. I mean, it sounds like if you can give me a little bit about the Alzheimer's Foundation of America.
So we were founded in 2002 by a caregiver who cared for his mom back in the 80s and 90s and really had no place to turn to for any guidance, support, or counseling. And when his mom passed away, he founded AFA to ensure that nobody goes on this journey alone. So our primary focus is caring for and supporting caregivers, providing education both to professionals and non-professionals in the healthcare industry, and funding research for new therapies and a cure.
So this is like a situation that a lot of people are in. My mother was in it for a while. My wife was in the same situation, taking care of her mother, where she really didn't know who to contact, and it's sad because she went to her mother's doctors, and the mother's doctors didn't know who really to reach out to, because you talk about taking care of the Alzheimer's patients themselves, but then there's a certain amount of stress that's on the caregiver.
Oh, it's overwhelming. Both emotional and physical stress can be overwhelming. And, this is exactly what our founder, who's our board chairman, Mr. Bert Brodsky, went through. And, he would walk out of one room, go back into another to see his mom maybe a minute later, and she would yell at him, "I haven't seen you in weeks or months." And he would yell back, not knowing what she was going through. So, the gateway to all the programs and services at the Alzheimer's Foundation of America starts with our helpline, which is accessible by a phone, web chat, or text message, and it's staffed by licensed social workers that are specifically trained in dementia and Alzheimer's care. And that's available 7 days a week from 9 a.m. to 9 p.m. And in the absence of a AFA employee on the phone, we have a virtual helpline assistant, and her name is Allison, who can answer the majority of questions that a caller may have. But it's a toll-free number that somebody could just pick up the phone and call the Alzheimer's Foundation of America at 866-232-8484.
So it doesn't matter what state you live in. So if I have a problem, I call that number. If somebody in another state has a problem or has a question, they can call that number as well.
You're correct. Yeah, it's a national toll-free helpline.
All right. So we talk about, and I looked at a little bit of your information, and you guys offer what is known as memory screenings at particular sites. What entails a memory screening?
So we like to call it a checkup from the neck up. It's a series of questions to test your language, your thinking, and your memory skills. It's non-invasive, and it takes maybe 10 to 15 minutes. You'll receive a score. There's a baseline. If you score above it, we'll tell you to take it again in a year. If you score below it, we'll make certain other recommendations. But, it's similar to any other routine screening that you do with your primary care physician on an annual basis. Blood pressure, cholesterol, skin checks. We want to incorporate a memory screening every single year for individuals to take. And part of what we do is we educate and train primary care physicians to perform these screenings. But an individual, again, can call that number, that toll-free number, 866-232-8484. We could arrange it virtually, in person if there's a screening site, but we could do it virtually on the computer or the phone.
So this is a godsend for people who are close to their parents, or their parents seem to be showing signs of memory loss and those types of things, because I don't think a routine doctor will perform a memory screening every time they see them. But if this is something where if a loved one is concerned, they can sign the loved one up for one of those memory screenings and have it done online.
Absolutely, it can be. And, our staff is prepared to take that call and perform a screening at any point when it works for the individual who's calling for us. And we encourage this because, it could gauge your memory and cognitive functions. And why not take the test is the question we always ask people.
There's a difference between aging and the difference between having Alzheimer's and or dementia. What's the difference between those two?
So Alzheimer's disease is a progressive brain disorder that will impact an individual's language skills, thinking, and memory, and the ability to carry out such simple tasks. Alzheimer's disease is the most common form of dementia. Dementia itself is not a disease. Alzheimer's is a disease, but dementia is a terminology that is used to describe a combination of symptoms, loss of judgment, and other intellectual functions as well. But I want to go back to a memory screening, if you don't mind, the importance of that, because an individual could, be suffering or concerned about their memory, but there are many different conditions that can cause a memory issue, such as a vitamin deficiency, a thyroid issue, a urinary tract infection, depression, stress, anxiety, sleep apnea. These are all treatable, if not correctable, but this is why we encourage a memory screening, because you need to at least get to that point where you're concerned about your screening, your memory, and address it.
So will the memory screening tell the person who's administrating the screening, will it tell that person what may be the cause of the memory problem?
No, it's not going to do that, but that's why we encourage you to go to your primary care physician after you get their screening to talk to them about their results, because they can provide other tests, and find out, is it a UTI? Are you suffering from a vitamin deficiency or a thyroid issue or other things that may lead to memory concerns?
All right, so we need to take a short break. We are talking with Charles Fuschillo. He is the CEO and president of the Alzheimer's Foundation of America. We'll be back with more from him right after this quick break. And we're back on the BW Morning Show. This morning we are talking with Charles Fuschillo. He is the president and CEO of the Alzheimer's Foundation of America. I want to touch one quick thing on these memory screenings. This is something that is able to be done online, and those results can be shared with the doctor, correct?
That's correct, yeah. And again, we encourage everybody who's listening, go to our toll-free helpline number, 866-232-8484, and arrange for a free memory screening.
When we talk about Alzheimer's, are there key signs that people should be looking out for, say their older relatives or their spouse, that could show symptoms of Alzheimer's?
There are certain signs and symptoms. Memory loss, especially recent events, names and places, confusion about time and place, difficulty in judging certain situations, changes in moods and personality, struggling to complete a familiar task such as brushing one's teeth. If somebody's experiencing these signs and symptoms, address it immediately and go see your primary care physician, who may have to make other recommendations of different type of medical care.
So let me ask you this. Are we any closer to figuring out what causes Alzheimer's?
So there are many factors that the doctors and scientists have said, lifestyle, environment. We encourage people to live a healthy lifestyle. All of this can increase your risk. But there's more than 7 million people nationwide that are living with Alzheimer's disease. So the prevalency and the greater awareness is increasing.
Are there certain, say, demographical groups or populations or races or genders that are more susceptible to Alzheimer's, or let me rephrase that, we see Alzheimer's in those people more than others?
So 2/3 of those diagnosed with the disease are women. So women are affected by this greater than men.
And so that's a key sign, because I can picture my wife taking care of my mother-in-law, and I know there's other people out there whose mothers seem to have that issue. Are there tips or are there solutions to help the caregiver who is taking care of somebody with Alzheimer's?
Absolutely. One of the things we encourage caregivers to do is take a time out. It's important that you take care of yourself as well as the one you're taking care of to avoid caregiver burnout. Make sure you're eating properly, getting exercise, staying socially active to the best that you can. But one of the things that we feel is critically important or a caregiver caring for a loved one is you need to develop a caregiving team because you can't do it alone. And it's important that the primary caregiver has some time, has some space on their own to make sure they take care of themselves as well.
We're talking about mental health of caregivers, and not just caregivers that are caregivers for patients with Alzheimer's, but caregivers for people that are caregivers for family members who have other, disabilities. And mental health plays a key role in this.
It does. And, what's critically important is you realize that you have to avoid caregiver fatigue. Prioritize self-care by maintaining a healthy diet, exercising, trying to get enough sleep. This is so critically important while you're caring for someone that has been diagnosed with Alzheimer's or related dementia. It's important that you care for yourself as well.
So we talk about caregivers and taking care of Alzheimer's patients. At what point do you recommend that the caregiver step away from the caregiving role and turn it over to a medical personnel or a medical facility or a dementia Alzheimer's facility?
It really depends on the stages. There's many stages. There's early, middle, and late stages, which can be more severe. It gets to a point where a caregiver has to say to him or herself, I can't take care of this person anymore. This is a very, very difficult decision, and we deal with so many families whose, spouses have been married for 50, 55, 60 years, and they'll tell you, I've taken care of them all my life. I'm not allowing somebody else. So the first part of the transitional period should be bringing somebody in, whether it's a few hours a day or a few days a week, to help you with the caregiving transition. That at some point you may have to place your loved one in a residential care facility.
All right, Charles, I thank you for your time this morning, but I want to give you one last opportunity to get that 800 number out there so that people know who to call if they need help.
Sure. If you're concerned about your memory or a loved one, just pick up the phone. Call the Alzheimer's Foundation of America's national toll-free helpline at 866-232-8484, and you'll have an opportunity speak to a licensed social worker that is dementia specifically trained. Thanks so much for having me on.
All right. I thank you for your time this morning. We've been talking with Charles Fuschillo. He is the president and CEO of the Alzheimer's Foundation of America. We'll be back with more BW News right after this. This is KWBW, Hutchinson, Kansas.